Now, I have the pleasure of introducing our esteemed panel here. So I am going to begin to my far left. I'm not sure why I'm trying to begin at my far left, but it makes it easy for me. I want to... No comments, right? Editorial comments here, but Rosa y Martínez Colón. Rosa, a native of Arecibo, Puerto Rico, and a living testament to the transformative power of the grassroots efforts. As a founding member of CALOR, CALOR is an acronym for Comprensión y Apoyo a Latinos en Oposición a Retrovirus, which would be translated Support and Understanding for Latinos in Opposition to the Retrovirus. She led a movement for Latinos affected by HIV in Chicago who were lacking services that responded to their cultural and language needs. Rosa has been involved in this social service span of HIV, health, and wellness over 30 years. A couple more things. In 2021, Mayor Lightfoot appointed Rosa to the Chicago Board of Health, and she continues to serve on the board today. Welcome, Commissioner. And in 2024, Rosa joined the Center for Housing and Health at the AIDS Foundation of Chicago as the VP of Housing Strategy. That, my friends, is Rosa. I have also the pleasure of introducing Ray Lewis-Thornton. I would call you Reverend, but I want to be.
It felt good.
Yeah, it felt good, okay. So not only is she a Reverend, but she is an Emmy Award-winning AIDS activist, author, and renowned social justice advocate. Ray received national acclaim for her story with HIV/AIDS in the Essence magazine in the December 1994 issue. In fact, the Smithsonian National Museum of African American History and Culture has requested to catalog her groundbreaking Essence magazine cover. Ray is a survivor of childhood sexual abuse and a cycle of trauma. She educates on trauma-informed care, writing to heal from trauma, HIV/AIDS, and self-esteem. She's a freelance writer on health and wellness. As I started to mention, she's also an ordained minister. She earned a Master of Divinity degree from McCormick Theological Seminary. She received the Arthur Hayes Fellowship in Church History from McCormick upon graduating, and she's currently conducting and completing her doctorate of ministry at the Methodist School of Ohio. Her doctoral focus is how the Black church can help individuals heal from trauma, and she conducts trauma-informed trainings for church leadership. I want to say a couple more things. With her story and her narrative and presence, she has been featured in countless magazines. I have a sizable list here, but I want to highlight that she's been part of the Oprah Winfrey magazine. She's been covered by BET. She has received, Essence, Jet, Ebony, Emerge, Black Excellence, Heart and Soul, HIV+, and so many others like The Real Health Focus and The Crisis. Many newspaper outlets such as the Washington Post, the Chicago Tribune, and the Chicago Sun-Times have covered her story and her journey. She's also a published author with 3 books. I don't know where you find all this time. She's an Amazon bestseller. Wrote Unprotected, a memoir, The Politics of Respectability and Amazing Grace, Letters Along My Journey. And her latest book is What I Learned from Digging in Dirt. And this one is going to be released in 2025. She has lived with HIV for 41 years. Welcome, Ray. Thank you for being with us today. And then I have the distinct pleasure of also presenting Victoria Noe. And I want to say that my notes on her is that she is deep into her 4th career. Victoria Noe is a Chicago-based award-winning author, a speaker, and activist with 2 degrees in theater. Her Friend Grief series, the result of a promise she made to a dying friend, recognizes the importance of friendships in shaping our lives and illuminates an often disrespected form of grief. Her longtime HIV/AIDS activism led her to write this book, Fag Hags, Divas and Moms, and you can get your copy today. It's ready for you to purchase. And I asked her before we started, yes, she does take Zelle and she does take Squirm. So don't leave without taking a copy of her book with you. Again, Fags, Hags, Divas, and Women, The Legacy of Straight Women in the AIDS Community was a groundbreaking book that honors the women who changed the course of the epidemic. She's currently working on the second edition, which should be published in 2025. Wow, that's great. An accomplished public speaker, she has presented to a wide variety of organizations and events, including ACT UP in London, Mount Sinai Hospital in New York, the Muse and the Marketplace in Boston, Book Expo America, and Open Hands San Francisco, as well as libraries and bookstores and dialogues and series and conversations like these that are happening today around New York State and the Midwest. During COVID, she led workshops for Let's Imagine and Global Grief Network and led writing groups online for Honoring Our Experience, an organization of HIV long-term survivors. Noe's newest award-winning book, What Our Friends Left Behind, Grief and Laughter in a Pandemic, shares the challenges faced by people who grieve a friend during COVID. Noe is a member of the Alliance of Independent Authors, Chicago Writers Association, ACT UP New York, and the AIDS Garden Chicago Storytelling Committee. You can keep up with her work, and we certainly will remind you and give you her link, but you can go to victorianoe.com to get more information about all the work that she is doing. Welcome, Victoria. Delighted to have you.
As you can see, we have very varied backgrounds and experiences that are all relevant to Chicago women's history. And so I'd like to start off with a general question for, that we can discuss, which is, what do you think is unique about the HIV/AIDS epidemic in Chicago as opposed to New York or San Francisco or other places?
Well, I think historically, we have to acknowledge Cook County Hospital and the work that took place there. The first AIDS clinic was founded by Dr. Ron Sable, who was a white gay male here, openly gay man here in Chicago, who actually ran for alderman. He was the first openly gay man to run for alderman, and Dr. Winslow Shear. And the way they explained it, the way it was explained to me with Winslow, they had so many men that were coming in those early days with AIDS that they asked Dr. Gordy Schiff, who at that time was the director of general medicine, could they have a space at Cook County? And they literally took a part of the hallway at the general medicine clinic and started the first AIDS clinic. And then secondly would be Dr. Marge Cohen, who actually is the wife of Gordy Schiff. And she was general medicine internist. And a woman came to her, and she's a feminist to the core. And a Hispanic woman came to her, white woman, came to her and said, "You call yourself a feminist, and women are dying. Women are dying. Women have no resources." And she heard her loud and clear and founded the Women and Children HIV Clinic at Cook County Hospital. What Marge saw, what she saw was that women would come, that they would bring their children who were infected, but then they wouldn't come back for their own treatment because of the hardship of getting on the bus. You have a sick child, you're sick, so they wouldn't do the double trip. So she created this clinic. And when I tell you our waiting room was the size of the back half of this room, that women would bring their children and we would get seen together. Yeah. She would see the patient, and it was a full service. She had a gynecologist in there. that would take care of our gynecological needs, because we found that women with HIV had more gynecological. She had a pediatrician in there that would take care of the child. We had a little playroom and a little, not in on the outside, in the hallway of Cook County Hospital. And we were there every Wednesday in the radiology clinic. That was the day that Cook County gave us. When I first got to the clinic, I was there because Dr. Sable, I worked for, if you all know the name, Quentin Young. I worked for Quentin Young and Ron. I was organizing doctors in healthcare for healthcare reform, and I worked for them and I couldn't get health insurance. And I finally I transitioned to AIDS. The doctor at NIH told me that I needed to get on some different kind of medicine, and I went and I told Ron that I had AIDS, and he looked me in the face and said, "We'll take care of you." And so he told me to call Gordy's wife, and that I would get, because Gordy was on the board, Physicians for a National Health Program. And March said, it was so funny, I said, "Dr. Sable said for me to call you, and I had been telling people I have AIDS." And she said, "You have AIDS? Okay, come to Cook County Hospital Radiation Clinic at 1 o'clock. I'll see you then." I'm like, who is this woman? And the women, and so I would come in my business suit and my makeup, the diva that I am, and I wouldn't let anyone talk. I wouldn't talk to anybody. And the women were like, they're trying to figure out who this well-dressed black girl is in the clinic. And people would say, "Do you work here?" "No." And it took months for me to loosen up. But it was the only place we could talk about our partners not wanting to use condoms, knowing that we had HIV. It was the only place that we could talk about how our partners infected us, how our families deserted us. It was the only place we could get hugs. March Cohen created that place for women in Chicago.
Now, was there a situation where it was discontinued and then they...
This is what happened, a rub. There was a lot of still stigma around AIDS. And what we found was that we were in the Women and Children Clinic, but we had to go upstairs to get our blood work done in the Fantas Clinic. And we would wait for an hour. Well, it's always an hour at Cook County Hospital, but we would wait 2 hours because we learned that nobody wanted to draw HIV blood. So then became this brilliant idea to create a state-of-the-art, I'm giving you history now, the state-of-the-art clinic where people in Chicago would come and get dignified health care. It would be a one-stop shop. We would get our x-rays, our labs, our psychiatry, we would see our doctors, we would get our medicine. It would be this one place. Christy Hefner led the funding campaign. I sat on the community board. The Core Center became the state-of-the-art, the first of its kind HIV clinic. And so, it was infectious disease clinic. So we saw herpes, they all saw hepatitis. Okay. One-stop shop, studies would be conducted there, and a little March Cohen hate and a little misogyny. They decided that they didn't need a director of the women's clinic anymore, that they would just have one executive director of the Core Center. And so that's how she got pushed out as the director of the Women and Children AIDS Clinic. That's how the name of that clinic kind of dissipated, and we all became the Core Center. It didn't happen right away, but it eventually happened. She never left, she stayed. She continued to see patients over at Cook County and see patients over at the Core Center. She founded the Women's Clinic in Rwanda that she's just retiring from. She's lead investigator in the WISE study. And the most significant, am I lying? Research on women and AIDS has come, in this country, has come out of WISE. So, people didn't like Marge because she was brash. For whatever reasons you didn't like Marge Cohen. She kept me alive. She kept me alive, and she kept her patients alive. And she was pharmaceutical companies hated her. Reps, she was a no-see doc. I don't have time to talk to pharmaceutical reps. I'm trying to save the lives of my patient. Patients came first for Marge Cohen. I was telling Vicki, I never stopped taking my medicine, even at the worst. One day I laid on my bathroom floor and threw up and pooped for 6 hours. When I finished, I had acute gastrointestinalitis from the medicine. When I finished, I took a nice warm bath, I put on some body cream, I went to the telephone and I called Marge Cohen and I said, Marge, I quit. The quality of my life is more important than how long I live. And she started screaming, you gotta give me more time. You gotta give me more time. You can't quit on me. She was just screaming in the phone. And I gave her more time. And she said, we're getting something new. Because see, County didn't get the whole formulary of HIV medicine. So I had to wait until the next thing. It took a year for the next thing. Another woman in the clinic said she was an addict. Every time she'd come there, she'd be like this. She's still alive. She said, and everybody that knows Marge Cohen knows she's about 5 feet. This girl is about 5'8". Marge grabbed her by the neck and threw up against the wall and said, what are you gonna do, live or die? She's still alive. Marge would go on to write a grant for the first natural history study of women in AIDS in the United States. It's called the Women's Interagency HIV Study. Studies like that are always given to big hospitals like Northwestern. She fought to bring that study to County. And think about it this way, which of course Vicki will always appreciate. The Women's Interagency Study started 10 years after the men's study. So NIH had been studying men with AIDS, and women, mostly women of color, were dying from AIDS, and they had not studied what AIDS looked like. And what we found was that AIDS did look different in women than it did in men. And so Chicago has a rich history. Almost all, in the last 30 years, almost all the significant research on women and AIDS have come out of the WISE study. And it started, and they had other locations. I think they chose 3 locations. I talk about it in my memoir, which I also brought. I really do talk about the rich history of women and AIDS in Chicago and how it was situated and what happened here. And so when I think about the history of AIDS, you have to recognize that it was at Cook County Hospital with activist doctors who took the lead and the charge to help people who were dying. Telling women's stories. As I was writing the book, and I'm gonna close with this, one of the women in the clinic, who was one of the old school women, who had started in the clinic with me in the early 90s, she said, put my name in your book. And I put her name in my book. And a month before it was published, she died of breast cancer. But even with that, and this is the last time I give it up, even with that, as progressive as it was, they still didn't admit women into Cook County Hospital with AIDS. It was a men's only ward.
You know why?
Right, you tell that part, which is funny.
Because I do tell the story
It's in my book.
about the bathroom. There was a huge demonstration here in 1990, I think,
Yeah.
against the American Medical Association. All the ACT UP groups came into town, all these activist groups came in, and they went to Cook County. And they actually the Cook County building is where they went to. And they were protesting because, as Ray said, there were no women being treated for AIDS at Cook County. There was no place to put them. Because even though there were empty beds in the men's AIDS ward, they were told women could not be admitted there because it was not a ladies' room for the ward. They did not have their own bathroom. And Cook County said they did not have the $1,000 they needed for this bathroom. So this demonstration happened. They threw down mattresses in the street in front of the Cook County building. They demonstrated in front of the hospital, and the next day they found $1,000 and got the bathroom.
Absolutely. And so you see, while we still had a rich history, that women were still locked out and left out, and it was the activism that that really got the most important things done here in the city of Chicago around AIDS. So that was my take.
It's interesting that you mentioned that, because that is exactly the reason why I started in the field. I was about 23 years old, and I was invited to a training by a friend, and it was on HIV and women, and I was appalled at the lack of services that didn't exist at all for women. And it even got worse if you were a Latina woman that spoke Spanish only. There was nothing available. And so that is what prompted me to start with Calor, because we needed to do something. We had to do something. So going back to the question, I don't have the experience of what happened in New York or San Francisco to be able to point out the differences. However, I think that a common thread amongst the cities is the camaraderie that existed back then, the sense of urgency, the sense of we have to do something.
Looking back at those early days when people were getting sick and they disappear, and the next thing you knew, their obituary was in the Windy City Times. That's how you found out they were sick, much less dead. But it's hard to believe that there was fun going on. There was a lot of fun going on. There was, believe it or not, a lot of sex going on. And because, gay men figured out pretty quickly how to have safe sex, and which benefited everybody, actually. But, like even in the worst situations, I was the development director at Chicago House, which provides housing and support services for people living with HIV and AIDS. And my assistant was HIV positive, and I did not want him to be my assistant because I needed someone who could do the literal heavy lifting. We were averaging a fundraising event every week, so there was a lot of work, physical work to do. But he was a great guy, one of the most wonderful people I've ever known. And about 2 years after I left there, he was dying. I found out he was dying, and I called his partner and I said, let me come over for an afternoon to give you a break. And he's like, no, you don't want to be around him. I'm like, I do want to be around him. Just tell me what I need to do. So Steve had AIDS-related dementia, and he didn't seem to know who I was when I walked in. And Michael went out to go to the grocery store or whatever, and Steve was sitting on the sofa with his blanket around him, and I was sitting on the chair, and he was talking directly to me. We made eye contact the whole time. But he was talking gibberish. I had no idea what he was talking about. And all of a sudden, he stopped and he said, so do you think I'm nuts? And without thinking, I blurted out, no more so than usual. And we both laughed, and then he was gone again. And that was the only time during my visit that he was lucid at all. But when I think back on it, it still makes me laugh because that's how we were. We threw spitballs over the wadded up papers over the divider between our desks when we worked together. We did have fun. There was a lot of dancing. Mm-hmm. Remember the 80s, there was disco, there was everything. Lots of dancing, lots of fun. We had a booth at the Pride Fest with the dunk tank. And, there was every opportunity that you could escape from what you were in the middle of and find some joy, you took it. Because there wasn't a lot of it. You had to grab onto it.
Go on to the next question.
Sure. This is a question I actually did not ask when I was interviewing women for the first edition of my book. But as one woman who's become a friend was leaving the room after her interview, she turned around and said, "We can talk about misogyny whenever you're ready." I thought, okay, and I'm ready. And so my question is, in what ways have you experienced misogyny and racism in the community? Where do I begin?
The thing is this, and I mean no offense. White liberals have the tendency of saying they want you in the room. But when you're in the room and you have a different opinion, you bring your culture, you bring your history, then it becomes problematic. You become problematic. You become angry. You're beating a dead horse. What do you want us to do? So that is a real thing across liberal corners, whether it's a political campaign, whether it's an issue campaign, whether it's AIDS. And so I'm gonna say that because white women have a privilege that I do not have. And you bring your privilege with you everywhere you go. So I wanted to say that. But the thing about Dr. March Cohen and the Women's Interagency HIV study and the medical community, so I'm going to start there with the medical community. They knew, the medical community knew. They started tracing the number of cases by race and gender as early as 1993. So they knew that black people, and that women were dying. I talk about all of this in the book. I really give a rich history of women and AIDS. The book is about how unprotected and violated I was as a child, and how it shaped the trajectory of my life. I really lean towards trauma-informed care, but I tell this AIDS story. So women were dying, and we were not even a part of the definition of AIDS until 1992, 93. Why was that important? Oh, so let's look at the definition so you'll understand it. Was the opportunistic infections like that people got that killed you. So you have HIV for 8 to 10 years, you have AIDS, the life expectancy back then was 18 months, and you don't die from AIDS. What you die from is these infections and bacteria, that kill you. People simplify it in terms of a cold, but there's actually a list called opportunistic infections, and they're very particular to AIDS. They were pneumocystis carinii pneumonia, which was the #1 infection. It's a parasite, AIDS-related pneumonia, on the lungs. Kaposi sarcoma. Remember Philadelphia, the movie Philadelphia, and the purple spots, which was a skin cancer. They didn't include cervical dysplasia, for example. Now, why is that important? Because what we found was that women with HIV had more cervical dysplasia. They didn't have KS. A small percentage of women had KS, but a large percentage of women had cervical dysplasia. Now, why is that important? Because Social Security approved disability based upon the AIDS definition. And because women were not included in the definition, women could not get approved for disability. You all hear me? And this is fact. You can Google it. If you don't believe what I'm saying, Google it. So it wasn't, the definition of AIDS then became, no, let me put this in. The average person has 1,000 T cells, more or less. 1,000, 1,200, 800 maybe at the low end. What we know now, or what the definition became, was a T cell count 200 or below, was an AIDS definition. So the new AIDS definition included women's issues with the way HIV actually manifests in our bodies, one, and they changed the T cell count to 200. T cell count wasn't even a part of the definition originally. They were only determining AIDS by the white men that they'd seen in the clinics, dying in the hospitals in the early days. There were women who had T cell counts of 67 who still could not get on disability because it was not a part of the definition. Oh, you hear me? So women were excluded. By 93, 94, black women, AIDS was the #1 death sentence for black women between the ages of 25 and 44. Period. We were dying. As early as 83, what's the name of the drug people, the government drug people, that enforce, the drug enforcement people? DEA knew that there was a correlation between sexually transmitted disease and black women that use crack cocaine. So when we talk about racism, let's talk about it on a personal level, and misogyny. So I just gave you a whole big thing. I kept my infection a secret for 7 years. My first 7 years, I told 5 people. And I didn't tell my doctor. I was in an HMO here in Chicago. I didn't tell my doctor because I didn't tell my doctor until I needed AZT. So I'm first generation AZT. I've been there, I've done that. I've taken all of the medications in the first class of HIV medications. At one point, my T cell count was 8. I've had 3 bouts of pneumocystis carinii pneumonia. I was wasting, I was a size 0, and my pill load was 31 pills a day. When I finally told the HMO doctor that I had and I found out through a blood drive. I donated blood, Red Cross sent me a letter. I was living in DC, working in politics. I was in a study at NIH. I'm gonna come back to the study in 2 seconds. So the study doctor at NIH was taking care of me, basically, So she wrote a letter to the HMO doctor that I had found out. We didn't give a date of when I had found out, and so that's how I got my AZT. I finally told my gynecologist at the HMO that I was having just repeated yeast infections. Like as soon as I got rid of one, like 10 days later, I'd have another one, which was also an opportunistic infection for women with AIDS. Men would get it in the esophagus and women would get it in the vagina. The esophagus was documented, but the vagina was left. I kept telling him. So one day I said, I have HIV. It's before I had transitioned to AIDS. Excuse me, he didn't say much. Sorry to hear that. As soon as I laid down with my legs up in the air, and he was looking between my legs, he said, "How does a pretty girl like you end up with AIDS, HIV?" He was the last doctor I told had HIV until I transitioned to AIDS and landed at Cook County Hospital. Now, the level of ignorance of doctors in the 80s and 90s was real. Because over at the Core Center, it wasn't the Core Center then, it was Cook County Hospital, they were prescribing fluconazole to regulate chronic yeast for both men with esophagus and women that had vaginal yeast. So I felt like my body was off. But because I was living in a secret with HIV, I didn't read articles about HIV because I worked in politics. They didn't want anybody to catch me reading the articles. I thought, I worked for presidential candidates and senatorial candidates. I wasn't going to tell the world I had HIV. And it wasn't until I landed at the Core Center with no health insurance that I learned that while the doctor was looking at my vagina and talking shit, that he missed a whole diagnosis. Just went out the window. And so I started talking about the privilege of white women. On Thursday, I am speaking in Chicago, and it's going to be Conversation and Cuisine with Black women. Do you know that AIDS right now is the #1 killer of Black? It is the third leading cause of death of Black women in Chicago between the ages of 25 and 35. What are we doing? What the hell are we doing or not doing? Think about it this way. If you're dying at 25, you were infected at 15, 16. If you're dying at 35, you were infected at 20. What kind of educational program? People, this newer generation don't know nothing about HIV, except that they can take a pill a day and not get it. And Black people don't even know, Black women don't even know that. And so misogyny is real and sexism is real. Vicki asked me earlier, she said, isn't it exciting that we have this new injectable for women with HIV? I said, yeah, it is. It really is. The advancements in medical technology are exciting. But you're not going to get any Black women to do that. You know why? Because the medical community injected us with the Prevero shot that was illegal and tested us on it. We took a Black woman's cells and made billions off of it. So what I'm saying is, there's a lot of work still to be done. This intellectual conversation is great. All of you wear different hats in different places. What are we doing?
One of the things in my book that I relate about why the misogyny is so infuriating. I'm 71, I'll be 72 in a couple weeks. I didn't get married until 1993. In all that time, so I was single in the 80s. I was single for the first 12 years of the epidemic. Then and now, I have never had a doctor ask me if I wanted an HIV test. Even back before I got married, when they knew I was working in the HIV community, and why do you want to do that? No one ever asked. So I asked a few times, and the response was always, why? What have you been doing? What do you think I've been doing? You know, it's like condoms break, you know, it's like, how much detail do you want me to go into, you know? That was not an unusual experience.
But the undercurrent in that is you are a white woman.
Exactly.
And you're a middle class white woman. Your lifestyle couldn't possibly be one where you would be at risk for HIV.
Right. Right. And I have friends, middle class white women, whose doctors took exactly that tack, even saying those words. What have you been doing? Why would you think you're at risk? Everybody's at risk.
Including the doctor.
Everybody's at risk. Why wouldn't I be, you know? But anyway.
What is infuriating is that, like you said, 40-something years into the epidemic, and we're still doing the same shit, you know? The racism that I have experienced, I think that it's more related to institutions rather than within communities. The Black and the Latina community have been pitted against each other to fight for the limited funding that is available. So these institutions like, you know, departments of health, federal, they started limiting funding to the community-based organizations. And that posed a big problem, because this is the community-based organizations where people will go, because this is within the community. They were part of the fabric of the community. And so they started moving funding away and segmenting funding by gay men, or men that have sex with men, or women. And women were the smallest group because women don't get AIDS. Because of that, I think that, you know, we continue facing these problems, like Ray mentioned, the fact that this is the third leading cause of death for Black women today in Chicago. That's ridiculous. In Puerto Rico, for example, and this creates so many problems, because in Puerto Rico, whereas here in Chicago, probably gay men are considered the highest at risk, in Puerto Rico, it's heterosexual women, the ones that are at highest risk. But there's no funding because they are not considered to be at risk. In the community, of course, you know, because we have been pitted against each other, there's always friction. However, my recollection, one of the best recollections that I have is when back in the late 1990s, we came together, Black and Latina-led organizations, as the People of Color Coalition, to demand from the AIDS Foundation of Chicago for a better distribution of the funds. They had the annual AIDS Walk and Run, and we will raise tons of money, and that money will go to big organizations, white-led organizations. What about the community? We're the ones that are bringing money. So we came together as the People of Color Coalition, and we demanded, and that changed because of our demands. So now the funding goes to the organization that brings in the money. Now we're raising funds for ourselves. But again, it's infuriating that now, 40-something years into the epidemic, and we're still doing the same thing, and we are, you know, wondering what is happening. Well, you're doing the same thing. How can you expect a different outcome? It's just the same. And back to the Ray mentioned about the younger generation, they think that, oh, you take a pill and that's it. It's scary because they don't know the basics. They don't know the basics. And that's something that I advocate a lot. I said we have to go back to basics.
Right.
We have to go back to the very simple things so that people understand, and even the history of how we came here, what has happened before. So I'm hoping, I still fight, I will continue fighting, but I would love to see a difference in the upcoming years. Because of the medical mistrust, like Ray has mentioned, we have been used as guinea pigs so many times that we don't even want to participate in clinical trials or anything like that. So, it's like a vicious cycle because we are not included, but we don't want to be included because what has been done to us without our... Correct.
Let me say this too also. It is true that in the US and in Europe that the majority of the cases in both countries are men who have sex with men. Period. I'm never gonna not, it's all men who have sex with men have always been the majority of cases of HIV. But it's black men and Hispanic men. Even with PrEP, the majority of the men, PrEP is the one pill a day to prevent, are white men. When we look at women with HIV, because women do get HIV, from men, the majority of the cases of women with HIV are women who had sex with a man. However that man got it, she had sex with a man. It is not impossible, but it is more difficult for women to infect men, period. I think where we're at with heterosexual, male to female, it's like 18% now. At one point it was like 10, 12%. Okay. When we look at women, the majority of the cases of women in this country are black women, then Hispanic women, then white women. And so there is a...
It is probably the most, even though we've been around for a while in the community, we're still in it now. We're in it now. And it's so frustrating to keep doing the same things over and over again because we have to. We have to keep working at this. But Ray's written books, I've written books. I want to ask Rosa why she wants to write and what she thinks writing about HIV/AIDS from her perspective can accomplish.
So I've always considered myself a behind-the-scene person. When I started Calor, I was in the office all the time. I was building an organization. I was putting together policies and procedures and programs and all that. So people knew about Rosa, but people didn't know Rosa. And it wasn't until 2011, when the United States Conference on AIDS came to Chicago, that I went to the meeting and I self-nominated to be a community co-chair, and I became the community co-chair. And to me, that is like I came out of the closet. That's when I started to get invitations, and that experience, the fact that I have been already, by 2011, I have been in the field for so many years and people didn't know me, that is what's prompting me to write, because there's many other women like me, many unsung heroes that have been doing a lot of work there in our communities, and it's a totally different experience for somebody from the outside to come and say, well, this is what it's being done in that community, that from somebody from that community say, this is really what happened, this is what I lived. Nobody but me and others that have lived through that can come and tell me how difficult were those days where, my calendar was filled with either hospital visits or funeral home visits. That you were You know, you were exhausted those days because you had people that really didn't have any family members, or family members didn't want anything to do with them, and you had to become their power of attorney, and you had to be dealing with all that. So those stories need to be told from the perspective of the community, not from somebody outside. And so that is what's prompting me to do this. I hold all the material for my organization. I can tell you what happened. I can tell you which alderman had opposed us when we wanted to bring a housing facility to the community, saying, we don't want those people here. The people are here already. This is your neighbor. This is your family member. What are you talking about? So that is what, these stories need to be told, and need to be told from the perspective of the community. We live this. Don't come and pathologize, you know, what we live. This is our experience. We are the only ones that can talk about this. Sure, your perspective from the outside is valid. You're seeing something different, right? But our story needs to be told. And that's what I'm trying to do with my book.
In 2014, I think it was, I was in New York. Our daughter was in college there, and she came with me to a talk at the New York Public Library. They had a new exhibit on AIDS activism in New York. Great. And they had a series of panel discussions, none of which were about women in the community. A couple panels had a woman on the panel, but that was it. So one of my friends from ACT UP, another straight woman, called them and said, why are women not part of this? And they said, oh, if you want to put together a panel, go ahead. So she did. And there were women on the panel, straight and lesbian from ACT UP, who had spent 4 years getting the government to change the definition of HIV and AIDS so women could get treatment, they could get diagnosed, they could get disability, they could get everything the men had been getting for 10 years. It took them 4 years fighting for this, to get the government to change the definition. And they did. And so, because this was at a time when one of the most famous posters read, women don't get AIDS, they just die from it. And it was very provocative and very true. When I started writing, my mother said, I had no idea you were going through that. Because I didn't tell anyone. Like Rosa said, you don't tell people.
And in telling your story, you tell the intersection of where people met you in your story. And it's not always nice for them because you're telling your truth. I'm sorry that you didn't behave correctly in my life, or that you disrupted something in my life, and I'm telling this story. Zora Hurston said, write your story or they'll kill you. Tell your story or they'll kill you and say you liked it. And that's really, really the truth. So for me, it wasn't just an AIDS story. It was, how did I get to AIDS? And what we will find with a lot of people who are living with HIV/AIDS, that there is a lot of trauma that got them to that place of HIV/AIDS. There's addiction, there is promiscuity. Well, of course, especially for black gay men, you're being ostracized in your own community. Your boyfriend's not welcomed at the dinner table. It's not even a place of discussion. So what does that do? It creates a level of low self-esteem. What do girls do with low self-esteem? It's the same thing. And so all the traumas, living in the house with the boogeyman, living in the community with the boogeyman, and having to go through a repeated cycle of trauma over and over again, it always keeps you in a state of flight, fright, or freeze. You don't make good decisions. You're always acting out of a deregulated cortisone. You know what I'm saying? And so I'm saying this to say that there are a lot of stories out here. There are brave women who have told their stories and other people's stories. It's no easy task. It is no easy task. And so I challenge you, I've given you some Chicago history, some really rich Chicago history about Martínez Colón, who founded an AIDS clinic. Not only did she found the Women and Children AIDS Clinic at Cook County Hospital and the lead investigator in the WISE study, but she founded a clinic in Rwanda and took WISE to Rwanda for the last 20 years. And so women like you who are in power, and you have the power of the pen, and you're telling our stories, please include the women who made a significant contribution to HIV/AIDS here in Chicago, even writing. What it took for Vicki to write this book, when she asked me to be in her book, Fag Hags, Divas and Moms, I was like, huh? And so I'm saying all this to say is that we're all in this together, and there's something that we have done, and there are some things that you can do, because people are still dying. That's it.
I'm sorry. And I wanted to add that I feel a sense of responsibility with people that entrusted their stories to me. I have a collection, because I've always liked to write, and so I told them eventually I'm going to write a book. Some people have passed, dear friends of mine, and I have their stories that they told me, you have to include this in your book. So it's my responsibility, I feel, to tell their stories. And we have some people that, you know, they played a significant role. In Calor, we had one person that, if I'm not mistaken, and I will be researching all this, but he was the first person that was sort of denied by a funeral home to be taken care of because of his condition, because of HIV. And we had to involve AIDS legal counsel and all that to make sure that he was treated. That was a big battle. So those are stories that need to be told. You know, nowadays you get this medication, and everybody's grateful for the medication, but they show people like living their great lives and all that. Yeah, but that was not the case all the time. We have to remember what happened before so that we know how we got to this point today.
When you read my book, and I hope you do, I want you to remember something. Almost every woman I interviewed who's in the book, and the ones who didn't make it into the book, had the exact same response when I told them I wanted to interview them. And they said, why would anyone care about what I did? And that was a reason alone to tell their stories.
Yep.
And that direct, you know, when I did book launch events, I included women from the book in my book launch events. And they were so adorable, because it was like people were coming up to them saying, thanking them for that. And no one had ever thanked them before.
I'm getting ready to do a series of workshops on writing, writing to help heal from trauma. Mm-hmm. And I'm thinking about very carefully how I designed the 2 days, because I just remembering something is painful. Mm-hmm. One of the prisons here in Illinois the authorities read my book. You have to read a book before they could be, and so we're talking now about me coming in, reading and working through parts of my memoir to help the women write their own stories and to help, because writing is healing. Mm-hmm. It's cathartic. It in a way that speaking about my life has never helped me, but the writing helped me see my trauma differently. Mm-hmm. This is so I'm an adult survivor of childhood sexual abuse. by the time I was 11, I'd been molested repeatedly by 5 people. And I was writing about my stepbrother and how he groomed me. And it reads like sex when you read it, but then you come back to my 10-year-old vagina at some point. But as I was writing it, I became sexually aroused because it read like sex. I was like, this is really weird. And so I put a pin in it, and when I got to therapy, my therapist said, which was something I was never able to get. She said, see, the body fails you. Even as a grown woman, the body fails you. A lot of adult survivors of childhood sexual abuse believe that it was their fault in some way, that they participated. Because Oprah said it best, and she got criticism, but it was true. It doesn't matter who touches the clit, it feels good if they ain't beating you over the head with it. And when you're 10 years old and you don't even understand what a clit is, it confuses you. So as you get older, you think, and as a black girl, I was called fast. Fast was the worst thing you can be. It was like we're trying to be grown. We're trying to act like a woman. It's a pejorative term that black women use to regulate black girl bodies. And so I thought I was fast. And so when my stepbrother said to me, because I didn't know sex, but I knew touching this way was fast. And I knew that fast would get me beaten. So when my stepbrother said to me, if you tell, we'll get in trouble, it locked me into his secret. Mm-hmm. No one had ever called a boy misogyny. No one had ever called a boy fast. So I had nothing in my regulation to say to me that he would get in trouble. But it would be me. And so it locked me into the secret. And I was 29 when I came to understand, when my therapist said, how does a 9-year-old have sex? But here I am, I'm 62 now. Here I am, 59, coming to a realization that my body failed me as a little girl, and it still failed me as an adult. But it gave me compassion for the little girl that I had